Good morning, everybody. Thank you very much for the invitation. It's a great honor and privilege to be here. And the topic of my speech today is the rising incidence of oral cancer in Eastern Europe, causes and solution. I will try in the next few minutes to answer the questions why still we observe the increasing the incidence in oral cancer in this part of Europe compared to Western countries in our continents, where seems the oral cancer disease is steady now. And I have nothing to disclose. And I will be separate my talk, and I will be talking about the epidemiology, risk factors, causes, solution, and remarks. And you can see in the whole world map, the Europe is marked by red color, and is in comparison to whole the world. And the Europe lives 742 million people. This is one of the highest population density is all over the world. And you can see also that is the population density in Europe here is very, very high compared to the different in other regions. And also the mean age is very high. And the European populations is the oldest compared to the another region of the world. And what is the definition on Central and Eastern Europe? When I prepared this presentation, nobody described this region, but most of the geographers told that this country belongs to this region. It's Poland, Czech Republic, Slovakia, Hungary, Slovenia, Croatia, Bosnia and Herzegovina, and Albania, Montenegro, Serbia, Macedonia, Bulgaria, Romania, Ukraine, Belarus, Lithuania, Litva, Estonia, and the European part of Russian Federation. If you look for how many people live there, is that 2/3 of the European population is over the 582 million people, and in Russia 142, and is also the one of the highest density population in European continents. And looking at the epidemiological facts and the lung cancer in men and breast cancer in women is on the top of the list in the cancer incidence in the Central and Eastern Europe. The oral cavity in men in the 7 on the lists, and the pharynx cancer 13 position, but you can find these two anatomical sites of cancer in the woman top list of the cancer incidence. But I think that when we take into consideration the preliminary epidemiological data, we can, I think that this very quickly reverse, and this cancer will be, the oral cancer will be on the lists. And here you can see the oral cancer incidence in Europe. And in the Central and Eastern Europe, we have the Hungary, Slovakia, and Romania in the highest incidence. But in the Western Europe is the Portugal, Belgium, and Germany. And you can see the Hungary the rate is very high, 9.7 for 100 inhabitants. and the second position is Slovakia and Romania. But if you compare this Central and Eastern Europe, it's not too big differences, especially, for example, for the Portugal and Slovakia. But unfortunately, the cancer mortality in Europe is very high. And you can see here is the one of the biggest mortality. I think is the reason for that is a different level and different access to the medical medical advices and treatment. And what is the two main risk factors is the tobacco and alcohol, and I would like to stress that in Eastern and Central Europe we have the higher percentage of smokers, especially is teenagers, and 20 to 35% of teenagers is heavy smokers. And if you can compare to the cigarette smoking is in Central and Eastern Europe, and in Central and Eastern Europe is still increasing compared to the Western Europe, where it's declining, the trends of the smoking. And the second very important factor is alcohol. And as you can see, in 35% of all adolescents are binge drinkers in Central and Eastern Europe, and the heavy drinkers prevalence among the adults is over 10%. It's a very high. Compare, for example, in the different part of Europe. And the other risk factors, we can include the sun exposure, sex, poor nutrition, HPV infection, ethnicity, and irritation from the dentures. And what is the specific causes, especially in the oral cancer in Central and Eastern Europe? I think I have to stress the lower economic and social status in this region, poor access to the medical care, limited tendency to seek medical care, and also the low education level. And also some the habits and the tradition. For example, in this part of Europe, and the climate is very, during the winter, for example, we have the very strong winter, and the people drink the vodka, not the wine or the beer, and also is the habitual everyday drinking and diet, and no standardization regarding screening in HPV vaccination. But regardless to any risk factors like age, sex, races, and ethnicity, in my opinion, the lifestyle choices still remain the biggest causes. And the second, that is the most people are dying because of ignorance, the problem, especially in the beginning. Are there any solutions to reverse those trends? And the solution is avoiding the risk factors, is the primary prevention, and also is the secondary prevention is possible to detect the early precancerous lesion like leukoplakia and erythroplakia, and of course start with the chemoprevention. And 75% of all oral cancer could be prevented by the elimination of tobacco and alcohol. But I think that we are on the way with try to cessation of this consumption, the tobacco and alcohol in this region of Europe. And what we've done in Europe in head and neck cancer is we promote the Make Sense campaign. Is this campaign run by the European Head and Neck Society? Is the main aim is to raise awarenesses in head and neck cancer. And we would like to do promote the education in prevention disease and to be driving to understanding the signs and symptoms and encouraging the very referral to and presentation to the patients to the Center of Excellence. And we also prepared some very popular now in leaflets is the leaders of the head and neck. We start to, in this campaign, promote the one for free. One of the symptoms, we selected 6, the main symptom of the head and neck cancer. If you have the for one of these symptoms longer than 3 weeks, you have to seek the medical advice in very, very quick. And another solution is the sexual education at school, oral cancer education for the public, education training of dental and non-dental healthcare officers, and also the mass media campaign. But I think when I would like to stress that the conclusion is not only is important for this special region of Europe, but all of the world, that is the prevention, and prevention, I think is one of the most important issue what you have to do in the future. Thank you very much for your attention.